is membranous cataract. This cataract happens when there is resorption of the lens material and fibrosis of the anterior and posterior capsules. These are two different patients, and both patients were adults actually, above 30. When you hear the term membranous cataract, the first thing to come to your mind is congenital. So, membranous cataract is a form of congenital cataract which is bilateral, and there are several gene mutations being investigated to be involved, and was linked to intrauterine infection, intrauterine rubella, and intrauterine uveitis. It's very important to know that membranous cataract might be referred to your clinic for a child with leukocoria. And in these patients, you really need to differentiate Coats and Coats-like disease. You need to differentiate retinoblastoma, because actually in these children who are already difficult to examine, you can't see beyond the fibrous membrane. It's really dense, as you can see. So in some patients who had cataract surgery for such membranous cataract, there are some reports that it's associated with persistent fetal vasculature and persistent anterior hyaloid vascular system. That's why UVM is an important investigation for such children with such kind of cataract. And the management in congenital membranous cataract is surgical removal. So when we come to management of congenital cataract, you need to treat congenital cataract if it's posterior polar, if it's total cataract, if it's membranous cataract. So child with such kinds of cataract needs treatment, while you don't need to treat zonular or anterior polar, and of course the blue dot, the coronary cataract. You don't need to treat this. These are usually visually non-significant. These photos were taken from adult patients actually. So the second form of membranous cataract is acquired. And in acquired membranous cataract, this is usually, acquired membranous cataract is usually an end stage, mature or hypermature cataract. So it might happen in senile mature or hypermature, or might happen in traumatic cataract. So